Okay. Call the Health Services Committee meeting to order. Can I have a motion to approve the minutes of the last meeting? Supervisor Bruno, second. Supervisor Gillian, all in favor?
Aye.
Opposed? Okay, we're going to start with Janelle. She has a couple of items for us. Oh, wait, before I do that, anybody from the floor have anything that they would like to address? Oh, Robin, please.
I'll be quick.
That's okay. You can be fast.
Hi, I'm Robin Larkin. I'm a resident of Queensbury, and I'm also a mental health professional here in town in private practice. So Rob York's presentation, he drew everyone's attention to the spike in mentally unfit to serve, to go to trial. Yeah, I don't know if y'all remember that from the presentation. There was a huge spike. So as a mental health professional, just like all of you, I was like, oh, what is that from? Because if we want to bring how much that's going to cost us, we got to figure out the why. So I luckily ran into a colleague who does forensic mental health evaluations, which are mental health evaluations for the justice involved. So I said to her, is there any research? Do we know why there's been such a spike in people who aren't mentally fit to stand trial? She said, no, there's no research yet, but I'm not surprised. I said, tell me. So the short answer is COVID, but the longer answer is COVID hit when my industry was already overwhelmed. We were already overtaxed. We don't have enough providers, especially in Warren County. And then you add COVID, which everybody's mental health went downhill. We were completely, y'all remember, right? It was 3 to 6 month waiting periods. It was awful. We're still kind of there. So that's really where the spike is. I use the analogy of diabetes, right? If you have diabetes and you can't get to your doctor, you can't get to your medication, what happens? Your diabetes gets worse and you might end up in the hospital. This is the same situation. If you can't get an appointment with a provider to manage your anxiety, your depression, it's going to worsen. And when things worsen, you can end up in a case where you aren't mentally fit, right? So this is especially important for our North Warren supervisors. My colleagues and I, we talk all the time that there's not enough services up north. And Warren County doesn't use a mental health department. We use community partners. Well, they're overwhelmed. They don't have enough resources just to manage their own area. So as much as we would like to go into North Warren and provide those services, maybe with a mobile unit or coordinate with churches and have offices. I worked with somebody who did that. They provided services in Greenwich by renting an office once a week in a church. We don't have the emotional bandwidth, the mental bandwidth, or the financial resources to do that. So I just wanted to share that the reason why that spike is so high the past couple of years is my industry is overwhelmed. We don't have enough providers. And that's most likely the reason why we are seeing that spike. So we need more mental health providers. I don't know how exactly that's going to happen. I have a couple ideas, but that's not for today. But I wanted to share that information with all of you.
Well, thank you very much, Robin.
You're welcome.
Okay, anybody else? Hey, Janelle, the floor is yours.
All right, good morning, everybody. We have 2 resolution requests before you today. The first one is to amend our 2024 budget to reflect the healthcare worker bonus payment. We had a staff member that was eligible, and that's a requirement through Medicaid that we have to do this. So we paid out the person. So we need the ability to be able to accept the revenue to be able to pay the person. And there's questions, Tom's here.
Okay, someone make a motion, bring it to the floor. Supervisor Wild, second Supervisor Bruno. Anyone have any questions for Janelle? Seeing none, all those in favor?
Aye.
Opposed? Abstain? Okay,
The second one's also good news. It's to transfer funds in the 2024 budget to reflect our fellowship grant budget modification to cover supplies, salaries, and fringe. At the beginning of this grant, which started in 2021, right in the middle of the pandemic, we had not really the ability to utilize this funding, which was over $900,000, because of all the restraints and us being overwhelmed with what we had going on. similar to what you're saying. And, we subcontracted with Hudson Headwaters, and the state took about a year to get us our contract. And then by that time, Hudson Headwaters was on to bigger and better things, and we were trying to figure out ways to utilize the funding. This fall, we were able to hire 2 nurses and a health educator. So we reached out to the grant people and we begged, borrowed, and pleaded for them to let us use the money to help offset the expenses of our salaries and fringe. And we won the fight, so to speak. So this is to help us transfer the money in that grant and in our buckets to be able to pay the salaries voucher and accept the expenditures. And Ton just did the first voucher that goes through the end of this month, which was around $109,000 that we were able to get that we weren't expecting. So that's good news.
And we'll be able to voucher from now March until the June, till the end of the grant. The rest, they've approved these 3 people, so we can continue doing that, which is good. We'll get something now. And it's been 100% of their salary and their fringe at this point.
Okay, can I have someone bring it to the floor? Supervisor Thomas, second. Supervisor Wild. Any of the committee have any questions? I have one. When this runs out, do these positions run out too, or
No,
they just stay?
These were positions that we hired without.
Oh,
the
okay.
grant. They're in our budget. We just creatively figured out a way to help offset some of their expenses. I will say this grant will be done by the end of June. But in July, we're gonna pick up with the infrastructure grant. So we got creative and are putting them in there. So, you know, if we can help offset costs of our staff through our grants, we try. But
Okay. Any further questions? Okay, all those in favor?
Aye.
Opposed? Abstain? Okay, that carries. Janelle, anything else?
we have our report of revenues and expenditures and our comparison report and our typical attachments. If you want Tom to review them, you can, or if in the interest of time, if you want to see me, if you have questions.
I personally don't have any questions, but I don't know if any in the committee do. Any on the committee have any questions about that? It was nice to see this because this was something we used to do years ago where we gotta look at where you stood on your budget. And I was just telling Amanda this, that I thought we used to do this with all the committees and all the departments, but I guess we don't. So that was nice to see because that helps you out when, you know, helps alleviate any trouble coming down the road, so. But any on the committee have any questions about it? No?
Tom, do you have anything that sticks out?
I just wanted to just say that these financials at this point are reflective of 2024, but 23 is still listed on there. It's not closed yet, but at least it gives you an idea where we still stand for 23. Once it's closed, we'll know.
Okay.
And that's all I have.
Anyone else have any questions for Janelle or Ton? Okay, thank you, ladies.
Thank you.
Rob won't be on this month, so we have Dee. Dee has outlined what her department does for you, and she's gonna do a little presentation.
Morning. So we have a couple of resolutions first.
Okay.
First request is to increase our ISAP contract with American Medical Alert, which is Connect America, from $7,000 to $15,000, and this is due to an increased request for services. The money is in the budget, and it is reimbursed 75%.
Okay, can I have someone make a motion to bring it to the floor? Supervisor Thomas, Supervisor Wild, second. Any questions for Dee? Okay, all those in favor? Opposed? Abstain? Okay,
The next item is permission to enter into a contract with Blooming Health. And this is to improve older adults' awareness of community-based aging services and benefits. This is actually being offered to us at no cost through the office for the New York State Office for the Aging and the Association on Aging. And basically, it's just a way for us to notify our seniors through telephone.
okay, motion to bring it to the floor. Supervisor Bruno, second Supervisor Wild. Any questions? All in favor?
Aye.
Opposed? Abstain? Okay,
All right, the next is just discussion items. Just want to notify you of a couple of different trainings. we have coming up. So there is the Leadership Institute, which is coming up in April. And this is where I go and meet with the other directors throughout the state of New York. This is April 16th through the 18th. Then we have the New York State Caregiving and Respite Coalition Conference, May 21st through 23rd. This one is down in Albany. And then the next one, it did not go to you guys for permission yet because I do not have all the details. But we have the Aging Concerns Unitas Conference coming up in June, June 25th through 26th. Usually Roseanne and I go in person, and then the rest of the staff participate via Zoom. So I just want to notify you guys of that. All the money is in the budget for these. And then we have our annual report, which I have a slideshow for you guys. So I'm gonna follow along a little bit with this document that you received. So you guys know, and then it kind of goes over an overview of what we do in the office as well, because you guys asked for that. So we'll go on to the next slide. All right, so we are a bi-county agency office for the aging. We are the only one in New York State, so we represent both Warren and Hamilton County. The two counties joined together in 1973. This gives you the resolutions of when Hamilton County did it, when Warren County did it, and then the date of the actual written agreement that I could find. With this, all Hamilton County expenses are paid for by Hamilton County, so it's not any cost to Warren County, so that you know that. As far as the funding goes, if NYSOFA does not tell us how to split it specifically, we do it based on the number of seniors age 60 and over in each county. Generally, it's a 30-70 split or a 40-60 split. All right, so we are directed by you guys, the Warren County Board of Supervisors, and then the Hamilton County Board of Supervisors. Ultimately, it's you guys that make all the decisions, but anything dealing with Warren County or Hamilton County, I go through them first. And then we follow the Older Americans Act of 1965, the New York State Elder Law, and then of course the New York State Office for the Aging, which I will refer to as NYSOFA throughout the rest of the presentation. It is important to know that no two offices for the aging are structured the same. So we all kind of operate differently. We include different departments as well. Prime example of this in Warren County, Office for the Aging is separate from Department of Social Services. In Washington County, OFA is underneath Department of Social Services. And then the Adult Protective Unit is inside Office for the Aging. So definitely different. The next three slides go over the different funding that we get from NYSOFA. The first one is the federal funding, and this program year goes from January until December. This is basically all of our Title IIIs. So the first column lists the funding. The next column lists how much is funded by NYSOFA, and then the maximum amount that we got from NYSOFA for 2023. Thank you for that. With this, I do want to mention that for the Title IIIC1 and Title IIIC2, although it says that 90% is funded by NYSOFA, both Warren and Hamilton County actually do more than a 10% match. And I'll go over that in a later slide. I'll tell you how much you actually funded for 2023. The next slide goes over the funding that we get from NYSOFA through the state. This program year goes from April to March. You have Community Services for the Elderly, Congregate Services Initiative, ISIP, Wellness and Nutrition, our health insurance, counseling, transportation, unmet need. This one started in 2022. It was a new funding source. We started receiving this one because we were able to demonstrate that if we did not get that county overmatch from Warren and Hamilton County for our nutrition program, that we would not be able to serve those seniors. So we were able to get an extra $150,000 each year, which is great. I will note that the MIPA, the Medicare Improvements for Patients and Providers Act, this program funding year goes from September to August. So all these funding programs have different dates. And then the last slide that shows the funding programs. This is all the monies that we received for COVID, the stimulus programs. This was all one-time funding, so we will not see this again. The only program or the only funding source that we have left is the CMC6, which is the third line up. That group there, we have about $30,000 left. All the rest of it we have spent already. Okay, and this is important because that will go to almost like the last slide that I show you, where I demonstrate that the county match is going to start to go up again. And this is why, sorry. This slide goes over all of the different programs and services that we offer within our Office for the Aging. I'm going to go over each one independently on the slides that we go through. And then on each slide, I'm going to tell you what funding program we use and then how we provide them. The only two I don't go over in a slide is the Advisory Council and the newsletter. The Advisory Council is made up of our seniors, different agencies. This meets on a quarterly basis, typically via virtual. Tammy sets up these meetings for us. And basically, we have the Advisory Council to go over anything that's going on within our department and then to discuss anything that we need to be doing for our seniors. The newsletter goes out quarterly, and this is our way of communicating with the seniors, what's happening in the area. We also put in our menu and then any activities that are happening within the senior centers. Okay. So application assistance, sorry. This is something that we do internally in our office. So we will help seniors 60 and over fill out applications for food stamps, HEAP, farmers market coupons, Medicaid, Epic, basically anything they need help with, we will assist them with. If it's something we're not familiar with, we might refer them to the actual agency that does it. This is typically funded through Title IIIB, CSE, New York Connects, HICAP, MIPA, and then of course the county match. This is the bulk of what we do in our office, and that's information and assistance. We have people calling our office, trying to find out where they can get salt during the wintertime for their driveways, up to getting meals, legal assistance where they can call for that, how to find help for their loved one in the home, where to go if they need placement. So basically anything they need help with, they will call our office to try to get that. Most of this is provided by our staff, but we do also have contracts with the Glens Falls Senior Center and the Association for the Blind. This is provided under funding through Title IIIB, CSE, New York Connects, HICAP, MIPA, and the county match. Then we have legal assistance. This is required by the New York State Office for the Aging. We have to allocate 7% of our Title IIIB funding for this service. We can use CSE funding instead, which is what we do in our office. 7% of our 3B funding, just for an idea, is about $7,000. We have a contract with the Legal Aid Society of Northeastern New York for about $18,000 to do this. It is not income-based, so anybody that needs this assistance can get it. We basically send the referrals to the Legal Aid Society and they help them out with it. The only thing that we can't help with is anything that is fee generating in nature. But most commonly, we help out with power of attorneys, last will and testaments, DNRs, healthcare proxies, things like that. Last year, just to give you an idea, we had 39 clients that utilized this service. Transportation, this is something that is much needed in this area as well as throughout New York State. We provide medical transportation as well as social transportation. For medical transportation, we do this with a contract through RSVP, which is under Tri-County United Way, and the Association for the Blind. And then we also arrange it through our office using our dedicated volunteers. When our volunteers do it, we reimburse them mileage. Social transportation program, this is one that changed, thanks to you guys for approving that in our budget. But typically what we were doing was contracting with the towns to provide this to the seniors. So now we have contracts with the town of Lake George, Lake Luzerne, Lake Pleasant, Long Lake, and Wells. And then we also have a contract with Warren County Veteran Services to provide transportation to the other seniors in Warren County that we no longer have community action providing the transportation for. This is funded through Title IIIB, CSE, transportation, and the county match. This graph gives the data for 2023 as to how it was used. The first column goes over the provider. Second column is the amount of the contract that we had. Third column is the number of trips. The next column is the units of service. Now, units of service and trips vary because the units of service is each stop that they make. So if on their social transportation, they went to Walmart, then the bank, then Price Chopper, then the pharmacy, each of those stops is a unit. So that's why the units of service are always higher than the trips. And then the number of clients served. For next year, this number will go up drastically because we had most of those towns that weren't able to utilize it last year. The expanded in-home services for the elderly program. This program provides non-medical in-home services for the elderly who are not eligible for Medicaid. This is an important thing. They have one or more disabling conditions, which prevents them from performing activities of daily living. The services that are included under this are case management, and then it can include homemaker personal care, which is PC2, housekeeper chore services, which is PC1, respite services, ancillary services, which is typically PERS or personal emergency response services, social adult daycare, home repairs, and home modifications. So case management, we provide in Warren County through a contract with Greater Adirondack Homeaids. In Hamilton County, we are going to be doing it with our staff. PC1 services and PC2 services in Warren County, we provide it through a contract with Greater Adirondack Homeaids. And then in Hamilton County, we do it through Hamilton County Public Health, Home Healthcare Partners, and Homeaids of the Central Adirondacks. Now in Warren County, we only have one agency, and that's just because no one else wanted to contract with us. And there is an aid shortage, so it's hard to find agencies that have the availability. For the PERS, the personal emergency response system, we contract with with American Medical, Connect America. Social adult daycare, we have a contract with Countryside Adult Home and Fort Hudson. Now, last year, we did not have any units of service, but Countryside Adult Home has opened up this year, and we have one person that we are hoping to get in very soon. Home repairs and modification. Last year, we didn't have any units of service for this service either. But typically, if we did, our office would pay for the materials or the supplies, and then the client would pay for the labor. Something for this would be like a ramp, a wheelchair ramp, if they needed that, or grab bars in their shower. And this is all funded underneath the ISIP program and then the county match. Any questions? Kind of going through fast.
Go ahead.
Thank you, Mr. Chairman. Just a question. Hudson Headwaters is opening a PACE center. Did that offer similar services to some of the stuff that
Yes.
you or we are doing?
Mhm.
And what effect will that have? Do you know? Too early to tell?
Yeah, it won't have an effect on us per se, but we will work with them to refer people to their services. But PACE is kind of going to try to be like an all-inclusive.
Exactly.
yeah.
On the face of it, looks like a very good
Mhm.
system, if you will. And it's kind of in its infancy, correct? In other words, there are a small number of
Mhm.
PACE centers to date,
Yes.
but I see that expanding
Mhm.
over the years, so.
Yeah, it's a great model. Right now, they're still waiting for their approvals,
Yeah.
and they've been waiting for the approvals for quite a while.
Long time.
That's the problem, unfortunately.
Thank
Yep.
you.
So this chart gives you the data for Greater Adirondack Homeaids for last year. From 2018 to 2023. So you can see in that first column, the number of units of service, and each unit is equal to 1 hour of service. So the number of units for PC1, which again is the housekeeping, shopping, chore service, the number of clients served for PC1. Then you see the number of units for PC2, which is the more hands-on, the bathing, dressing, the number of clients served, and then the total funding that we use for them. This slide goes over our personal emergency response system. That's the medical alert system. And this is why we asked for that increase in the funding. You can see that our units of service from 2018 to 2023 went from 5 people using it to 32 people. And the total units of service, and each unit is equal to 1 month, went from 48 to 302. So we've seen a drastic increase in the utilization of this program, which is great.
Sure.
Indeed, if you don't mind, I'd like to go back one slide, and it was,
Yep.
has to do with the home health aides.
Mhm.
And it looks like on the far left, the number of units are significantly down. From
For-
1,500 to 1,100.
Yep. For PC1, yes.
Yeah, so I'm just curious, what's the downturn related to?
That could be related to the number of people needing the service. So you'll also see that the number of clients went from 22 to 13.
Okay.
And this could correlate as well to the number of aides available. Now, we are currently seeing a shortage of aides, both in New York State and nationwide. And that is unfortunate. It is something that is trying to be addressed by increasing the hourly wage of the ages, or wages of the aides. So I think it was last year, there was a national effort or a state effort in the, maybe it was just New York State, to increase the minimum wage for ages. It only increased $2. And unfortunately, although the state increased that wage, they did not increase the funding to go along with it. Yeah.
Yes. So, is it, my thought is that it's really related to the number of aides. that
Mhm.
can help. It's not the easiest job.
Correct, yeah.
What's the hourly wage?
So I don't know what
You're at?
the aides themselves receive, but our contract rates go from $28 an hour up to $30 an hour. Mhm. The Medicaid rate is different than that, and that is determined by the state. And that's the rate that, that didn't go up, I don't think. But our rate is negotiable, so we can increase it. And we always do. Anytime they come to us and want to increase that hourly rate, we will do that.
Thank you.
Supervisor Bruno.
Thank you, Mr. Chairman. I'm curious, number of clients. First off, do you know offhand how many newsletters you send out?
So
Roughly,
we have over, I think it's,
relates to what I'm.
yep. So we send it to all of our home delivered meals clients. And then we also deliver it to all of the nursing homes, assisted living facilities as well. We currently have 374 clients getting home delivered meals. So I would say at least 400, if not 450 newsletters go out.
I'm trying to get a handle on, in other words, you have here 31, 32, 30, 26 clients out of a possible how many? In other words, if you had 500,
Mhm.
but only, I'd say only 26 are taking advantage of it. You see where I'm going? It's possible that at some point that could expand significantly, or maybe not.
We currently have a waiting list for our personal care services right now. Prior to last year, we did not have a waiting list at all. And we had not had one for several years. We have it because of the aid shortage.
Hmm.
And it's the first time that Warren and Hamilton County have experienced that. Other counties have had it, we have not. This last year was the first year that we started to have a waiting list. So
So-
we have people waiting to get the aid services. And that's because of the aid shortage.
Thank you.
In part, if you don't mind, part of the demographics is a part of that also. I expect it to get even worse as the years go on.
Right.
Yes, Mhm.
So this ought to be one of our biggest.
yes. Yep.
Exactly.
You're welcome.
Go on to the next one. This HICAP is our Health Insurance Information Counseling and Assistance Program. This also goes along with MIPA, which is the Medicare Improvements, Patients and Providers Act. I have to remember those acronyms. These two kind of go together. This is, these are programs that most people don't know that we do. This is basically where we provide non-objective health insurance counseling for Medicare, Medicare Advantage plans, Medicare Part D. So a client will call our office, say they're turning 60 or 65, they need to get enrolled in a Medicare Part D or a Medicare Advantage plan. Can we help out with that? We always say, call our office, make an appointment, because it takes at least an hour to do this. So you can't just walk in. Because we also need a list of all of their medications, including the dosage. You wouldn't know it, but the dosage makes a difference as to whether or not it's covered. And then a list of all of their providers. And the providers is not just the PA or the nurse practitioner, it's the physician that they're like providing the service under. So they make an appointment. Our counselors, they plug all this information in, and then they find out which of these plans is going to cover them the best. And then they refer them to a licensed healthcare agent that can actually sign them up. We can't enroll them in a program. We are not allowed to. We just give them the options and then they make the decision. We do have 2 dedicated staff members just to do this. I have absolutely no idea what they do because this is so involved and complicated. They do a spreadsheet every single year. It's a front and a back, and there's so much information in there. Generally, the open enrollment period for the Medicare and Medicare open enrollment is October through December. It is now expanded because you have special qualifying periods and everything. Right now, you have the issues with WellCare and Humana, where there are certain providers that are no longer accepting it in this area, Glens Falls Hospital, Hudson Headwaters. So that enrollment period has opened from October to November, all the way till April, and for some of them, all the way until July. So these guys are extremely busy right now. The phones are ringing off the hook for them. So we have the 2 staff members in the office doing it, plus we have a contract with the Greater Glens Falls Senior Center. And we fund this program through HICAP, MIPA, and then county funding. Because of course, we don't get enough from HICAP and MIPA, although it says it's 100% funded. So we have to use some county dollars for that. The nutrition program. So this is what everybody knows us for, is the nutrition program and those 4 services underneath it, which is the congregate meals, the home delivered meals, and then nutritional education and nutritional counseling. So for the congregate meals, this is where people can come in and join us for a meal at the meal sites. In Hamilton County, we have 4 congregate sites. In Warren County, we have 7. Last year, we served over 25,000 congregate meals. Then we have the home delivered meals program. A lot of people refer to this as Meals on Wheels. No. Meals on Wheels is a brand name. It's an actual company. So it's home delivered meals. I actually refer to it as Meals on Wheels when I first started, but it's home delivered meals. If you do it, I'm not going to slap your hand, but just so you know, it's home delivered meals. So this is where we provide the meals to the clients' homes that are eligible. And they're typically eligible if they can't get to the grocery store. They can't get to the congregate sites. They're not able to prepare meals on their own, and they don't have somebody that can help them prepare the meals. It is not based on income at all. So it doesn't matter what you get for income, what your finances are, as long as you meet those other eligibility requirements, you can get the home delivered meals. We do have to do an assessment to make sure that you qualify, and then also to make sure that there's no other services that we can help you out with. This is a requirement, and it typically takes about an hour to do this form. It is about 25 to 30 pages long. So it's a lot. And then this assessment then has to be done every year on an annual basis. In Hamilton County, we have 3 kitchens where we prepare our meals out of. In Warren County, we have 5. Last year, we provided over 95,000 home delivered meals. The next 2 services are our nutritional education and nutritional counseling services. These are provided by our registered dietitian. This is a requirement by NYSOFA. We do have to have a registered dietitian. So the nutritional education is where she writes articles that we put in the newsletter. She also goes to the meal sites and does a program, goes over healthy eating, different recipes they can make, things like that. And then she will also do one-on-one counseling with people that need it. So if they request it specifically, or if when we're doing that compass assessment, when we do a nutritional risk assessment, we determine that they need some counseling. We will do it as well. So how do we provide all of these nutritional programs? So our meal sites, and this is where you will see some of the differences between offices for the aging. Some do it internally, some do contracts. We do a little bit of everything because we have to be unique. So we have some meal sites where it's done all by our staff. We have one meal site where we pay for the staff, and then we contract with somebody to provide all of the food and the supplies and the electricity and propane. And that's up at Countryside Adult Home. And then we have a meal site where we completely contract out the services, and that's Salvation Army. And that's for our Queensbury Glens Falls people. Then we have Adirondack Community Action, which provides our meals for the Hague residents. Then, of course, we have Mom's Meals, which was providing meals to the Warrensburg, Chestertown area. But then we also had a couple of clients in Lake Luzerne that signed up because they had unique preferences. So when Warrensburg opened back up at Countryside Adult Home, we kept the contract with Mom's Meals just to provide those few unique clients with the meals, and we've kept that contract. And then Catherine Keatingstown, she is our dietitian. Our nutrition program is funded with Title III C1, Title III C2, NICEP, which is basically any food item that is grown within the United States. WIN, contributions from clients, and then managed long-term care companies, as well as the county match. The next 5 slides, I believe it is, goes over each of the meal sites. It gives a breakdown of the number of congregate meals, home delivered meals, congregate contributions, home delivered meal contributions received from 2016 until 2023. This is in your packet as well. I don't know if you guys want me to give you the actual numbers for 2023.
Sure.
Okay, so for Bolton, the number of congregate meals was 717. For home delivered meals, it was 3,607. The congregate contributions was $931, and for home delivered meal contributions, it was 1,463. The total cost to operate the Bolton meal site for last year was $62,680. Ready for the next one? The Cedars meal site. Number of congregate meals was 6,143. This will be larger next year because the Cedars meal site did not open up until the fall of this year. Number of home delivered meals was 49,257. The amount of congregate contributions was 3,636. Home delivered meal contributions was $24,698. And then the total cost to operate this meal site last year was $424,729. Chestertown, this information is not really that great because the meals are actually made and produced out of the Warrensburg meal site. But for the home delivered meals, they made 5,435. So next year I'll probably just combine that with Warrensburg. For the Johnsburg meal site, congregate meals, they did 2,574. Home delivered meals, 5,139. Congregate meals contributions was 4,156. Home delivered meal contributions was 3,932. And then the total cost to operate this meal site last year was $127,812. One item that was not included in the budget or in the cost for last year was a $12,000 range that we had to purchase because it wasn't delivered till this year. Next one is the Lake Luzerne meal site. So their congregate meals and home delivered meals is about equal. So they have a huge number of people coming into the congregate site. So both of them are about 6,000 people or 6,000 meals. Their congregate contributions was 12,908. Home delivered meal contributions was $6,758. And the total cost to operate this site was $82,733. And then the last one was the Warrensburg meal site. They only had 31 congregate meals, and that's because they didn't open until the very end of December. So this number will go up as well. Home delivered meals, they served 15,056. Home delivered meal contributions was $6,188. And then the total cost to operate this meal site was $170,238. Any questions on that?
No.
If you want those specific numbers, I can give them to you. This slide is probably one of the most important ones. It just gives you the average cost per meal for 2023 for each of the meal sites. And then in the brackets is the cost per meal for 2022. And then at the bottom, you'll see the average cost per meal for all of the sites. And then it breaks down just for Warren County and for Hamilton County. Some of the major differences you'll see where it dropped significantly is because in 2022, the food costs and supply costs were higher. And then we had a lot of repair costs, and we had 3 or 4 large pieces of equipment that we had to purchase. This one, it's not on the slide, but the total cost to operate the nutrition program, just the home delivered meals and congregate meals, for 2023 was about $1.3 million. If you deduct the total amount of funding that we got from NYSOFA, the federal and state funding, it leaves you with about $555,000. So the NYSOFA funding was about $57,000, and then the county match was $43,000. So that's where I said the county match is only supposed to be 10%, but both counties way overmatch. If we took out that unmet need funding that we started getting in 2022, it would be 50% that the county had to match. Now we can also deduct the amount that we get in contributions and manage long-term care companies. So it reduces it to about 33%, which is nice. And that's just the cost to operate those meal sites. It doesn't include any of the costs for the office staff to do the part that they have to do associated with the meals program. Then we have our New York Connects program. This is basically where we provide information to individuals of any age, any financial means, on long-term care services and supports. As part of the New York Connects program, we do have to have a long-term care council. This is kind of in the front part of your stuff, yep. So the Long-Term Care Council meets quarterly. It is made up of representatives throughout Warren, Washington, and Hamilton County. So it's government representatives, so the Offices for the Aging, Department of Social Services, Public Health. Then we also have different providers, the nursing homes, adult homes, caregivers, and then the individuals in the community as well. The reason we have the Long-Term Care Council is to identify gaps and barriers in services and then try to find solutions to address those. This is another area where we are unique from other Offices for the Aging because we did combine with Washington County. Initially, this was frowned upon by NYSOFA. Now we are one of the long-term care councils that they promote across the state. We also, as part of our long-term care council, we have a long-term care council digest that we put out 2 times a month. And we basically put together all of the events that are happening throughout the counties, put it all together in one concise area and send it out to everybody that's part of the long-term care council. No, anybody can be a part of it. So if anybody in this group wanted to join it, you just have to send me an email. We're getting there, Tammy. Then we have our disease prevention health promotion program. And this is exactly what it says. If we want to use Title 3D funding, it does have to be evidence-based. There are specific programs that are evidence-based, and it's basically studies that were done to show that actually reduces chronic diseases. There's different examples of it up there. In the past, we've had contracts with different entities to provide the evidence-based health disease promotion. And we just have not been able to. So starting in 2024, we will be doing this ourselves. We also do disease prevention and health promotion under CSE funding, but this is not evidence-based. So we have a contract with Warren County Public Health, and they do blood pressure clinics at the different meal sites and different senior housing locations. Last year, they provided blood pressures to over 103 seniors. Again, it's through contracts with Warren County Public Health, Hamilton County Public Health, and then it will be us. And it's provided under CSE funding, Title 3D, and the county. The last program we do is the Family Caregiver Support Program, Respite. This helps family members provide care for the elderly at home, 60 and over. Services can include information and assistance, counseling, support groups and training, respite, and then supplemental services such as PC1 and PC2. In our office, we focus on giving information and assistance to caregivers, linking them to the services, and then providing the respite care. We provide the respite care through contracts with the Greater Adirondack Homeaids and Hamilton County Public Health. This is all funded under Title 3E and then the county match. Last year, we had 6 clients receive over 1,000 hours of respite care. This slide is probably important to you guys. So this is the Warren County budget. So this one is in your packet. Probably towards the end. Yep, very last page.
Thank you.
So the top table shows the total expenses, for Warren County from 2019 to 2023, broken down by quarters. And then the final row gives you the total, expenses for the year. The next table shows the county share. So this is how much, Warren County actually had to pay for the services, again, from 2019 to 2023. And then the totals are on the bottom. This is the row that you're going to want to pay attention to. So you'll see in 2019, it was a little over 677,000. In 2020, it dropped to about 251,000. And then every year after, it was around that amount. Again, this is because we had all that COVID stimulus monies. Those monies are all gone. So for 2024, you're going to see that county share going back up to the 677,000 or around there. It's in our budget, so don't worry about it. Second to last slide. We're almost there. So these are the highlights for 2023. So what we accomplished for this past year. On July 1st, we initiated our contract with the Salvation Army to prepare meals for our Queensberry and Glens Falls residents. This contract has been going very well and the seniors have been very happy and it was a very smooth transition. In September, we had our first senior picnic since 2019. We had over 250 people in attendance. It was the first year that we started charging a small fee to our vendors to have a table there. And it was also the first year that it did not cost Warren or Hamilton County to have the senior picnic. We actually had revenue from it, which was nice. All of our congregate sites opened up in 2023, 5 days a week, with the exception of Solomon Heights and Salvation Army. Those two sites, we are waiting to have them open up, but we are hoping to have that soon. And it's based on the Salvation Army getting the staffing to do that. Social transportation, again, this is thanks to the Warren County Board of Supervisors for allowing us to include this in our budget for 2024. And also to the Warren County Veterans Department for providing the transportation. We were able to start this for our Warren County residents that did not have it on January 1st. With COVID funding that we received specifically for vaccines, of course, we received the funding well after we had done the vaccines with the help of public health, like getting them enrolled in it and registered. So we couldn't use it for that anymore. We did get special permission to purchase blood pressure cuffs, first aid kits, pulse ox machines, and thermometers. And then we distributed these to the seniors and the disabled population, either at our senior picnic or Hamilton County Public Health, Warren County Public Health, and the Southern Adirondack Independent Living Center distributed those. The high cap and MIPA changes, again, this is the health insurance stuff. There were significant changes in these two programs this year. For the MIPA one, the Medicare Savings Program eligibility requirements had a significant change where we had a 47% increase in client contacts and a 281% increase in the number of applications that we assisted with. So that is tremendous. And then, of course, the Medicare Advantage plans, the WellCare and the Humana that I already spoke about. And then the last thing on this slide is the renegotiation of the MLTC contracts. So MLTC is the Managed Long-Term Care Programs or Managed Long-Term Care Insurances, Essentia, Fidelis, VNS. We have contracts with them where they reimburse us for the meals that we provide to their clients who get home delivered meals. So since 2016, the rate has been $9.50 a meal. I was able to renegotiate with Essentia to increase that rate to $14 a meal, effective January 1st of this year. And then with Fidelis, we were able to renegotiate the rate from $9.50 to $12.50 a meal. Now, we renegotiated in December. We are still waiting for the contract. And it has nothing to do with the Warren County Attorney's Office. It is on their end. Just want to make sure I mention that. But these will result in significant revenue increases for us. Yes.
Where's Bruno?
Thank you. Could you describe the social transportation to me? Just
Yep. So that is where we contract with the Warren County Veterans Administration for certain towns. And then they will go to the clients' homes, pick them up, and then bring them down here to Glens Falls, Queensbury. And they will stop Walmart, Price Chopper, Hannaford, the pharmacy, banks, anywhere basically that the clients want to go, and then bring them back home.
Thank you.
We do it on Tuesdays and Thursdays, and each town is done twice a month.
Good, thank you.
Okay, and this is the last slide. We receive contributions for sorry. We receive contributions for our home delivered meals and our congregate meals. These are voluntary contributions. Last year, we received 49,000 from the congregate meal clients and 56,000 from the home delivered meal clients. And then we received $26,000 in reimbursement from the managed long-term care companies. This was an increase in $10,000 from 2022, which is pretty good.
Yeah.
And then just for statistical purposes, we had 214 new people sign up for meals last year. 242 people stopped their meals, and then it gives you the reasons why. I just want to point out that only 2 people stopped them because they didn't like them. So that says something. Most of them stop them because they go to the hospital, they go into a nursing home, they move out of the area, and then of course some, they pass away. And then currently we have 374 clients getting home delivered meals. So that's all I got. I'm sorry I went over.
That's quite all right, Any of the committee have any questions, sir? Dean?
Very good
No.
job.
Thank you very much.
And then if you guys want the slides, I can provide those as well.
Okay, anything else for the committee? Anyone from the public have anything they'd like to address us? Seeing none, motion to adjourn? Mr. Bruno, Mr. Wild, second. All in favor?
All right.
Thanks, Tammy.